Hi guys, welcome back to ARC Medical School. Today we'll be discussing some tips for clinical posting. So first of all, congratulations, you made it to 400 level. It's now time to go to the clinics, go to the hospital, shadow senior doctors, wear your ward coats, wear your scrubs, use your stethoscope, all that cool stuff. There are a lot of things that I wish people told me before I started, and it wouldn't have been so difficult to adapt, but I'll be telling you those things now, so it's not so bad. First of all, as you already know, get your uniforms, your scrubs, your ward coat, stethoscope, patella hammer, pen torch, all those equipment. I'm sure if you asked your classmates or your seniors, they will tell you, so it's common knowledge, everybody knows these things. If you have money for an expensive stethoscope, get it. If you don't, just buy anything. At least you should be able to hear your own heartbeat. That's the baseline. When you become a doctor and you start making cool cash, you can cash in on a better stethoscope. So the second thing is that you're going to be talking to strangers. I wish someone told me, because I was an introvert. So I wish someone told me that, okay, I'm going to be talking to strangers. And not just talking to strangers, I'm going to be asking them very personal questions, like, when last did you have sex? Or, do you have erectile dysfunction? And I'm a girl, I'm asking an older man. So it can be very embarrassing. But if I knew beforehand that I was going to be asking those type of questions, it would have been easier for me. The next thing is, you're going to be seeing a lot of nakedness, for lack of a better word. Nude people, because in order to examine human beings in their disease state or even in their normal state, you need to expose. So no clothing. Sometimes you know, if you are in departments that need to examine the private area, you need to go in and examine those areas. If somebody is having skin lesions, if they are having any disease state around their private parts, you have to examine those parts. So if you don't know beforehand, it can be very embarrassing. But as time goes on, you get accustomed to it and it won't mean so much. You just see this as somebody that you need to help, and this is something you need to do to help them. Another thing is that you should know the basics. We always say that in medicine, not knowing some things is unforgivable, right? There are some stuff that if you don't know, they are going to let you go. Nobody is going to say anything. But if you don't know basic things, like say how to check the temperature of a patient, or what it means when you hear a certain breath sound, or how to check the pulse of a patient, or how to do a general physical examination, or how to clerk a patient in order to know that there's malaria. There are some basic things. They are very simple. The tendency is that coming from preclinical, you tend to overlook the simple and go into the stuffy stuff that makes you look like a big person. But in clinical school, it's better to just stick with the basics. If you don't know anything higher, you can still pass the exam comfortably knowing the basics. So know the basics. An easy way to do that is to get all these small books. I don't know, they differ from school to school. In our school, I think we use mostly the guide. And then for pediatrics O&G, there's principles of pediatrics, there's principle of O&G. I think there's understanding psychiatry. There are all those little books that just have the basics of clinical practice. So if you can go through that before your clinical posting, amazing. Go through your notes before clinical posting, amazing. You can pass with your notes and with that book. But if you want to be a great doctor, then you need to read your textbooks too. But I'm just telling you how to survive the word rounds and random questions being thrown at you. My last point is take care of yourself. Clinical school is very draining, especially if you are just beginning. You'll probably be going to school at 8 and coming back at 8 in the night. If you are not careful, you will not even have time to read and to eat. It can be difficult. You might be tempted to fall into depression. You might all of a sudden realize medicine is not for you because maybe you don't like drugs, you don't like that consultants are many and they can be very intimidating. You don't like that you have to stand for several hours. You can realize you can just have an awakening in 400 level. But notwithstanding, hang in there, give it a few months, try to adapt, talk to your friends, have fun, talk to your family if they are welcoming. And with that, you can scale through. Try as much as possible, though, to read whatever it is you learned on the word rounds, to read whatever it is not to read in-depthly. which takes me to my next point, that you should have a jotter. So I still have my jottings from my first, second, third, fourth, fifth clinical postings. Things you learn on the round sometimes are even more stuffy than things you read in textbook. So try as much as possible that before you sleep, you go through those things. If you can't go through it before you sleep, then go through it at the end of the week. Just make sure you go through it consistently, because medicine is really about consistency. So try to touch on it once in a while. I think my last point, I know I keep saying last point, but I just remembered something right now, is that you might be verbally abused. So unfortunately, the hospitals and our superiors can be very hard on us. And if you get a question wrong, or you don't do something as correctly as they expect you to, you might be insulted, embarrassed in front of your colleagues, in front of patients, in front of other consultants or other superiors. So you have to grow thick skin and anticipate that, be ready for that. But honestly, I'm going to be very honest with you, that has never happened to me. So I think if you try as much as possible to blend in, don't stick out, blend in, do what you're supposed to do, study. If you don't know it, don't say you don't know it, say you can't remember, and just be you don't need to be a great student, but an average student. I don't think anybody would pick on you. They pick on people that they find that, are probably eccentric, or they are trying to show themselves. I think this is my 2018. This is my 4th year in clinical school, and no consultant, no senior registrar has ever picked on me. I hope you enjoy clinical school. I hope you enjoy your clinical postings. As you have long days, you can have really short days. You can go home as early as 10:30. That happened to me this past week. So it can be very fun. And if you're somebody that likes to interact with people, then you're going to love it, because you interact with people every day. So yeah, that's all I have for you guys today. Remember, you can be Doctor&Happy. If you like this, please like it right there. Subscribe. I think I'm the only one on this channel that says please, please, please subscribe. Leave comments in the comment section if you have anything to tell us, and if you have other tips that I forgot. Also share this with your friends, your family, your colleagues, your senior colleagues, etc. See you next week when we bring you another video. Remember, you can be Doctor&Happy. Bye.